So the focus of today's talk is men's health checks. In fact, we've made men's health checks our key focus for Men's Health Week this year. And we've put together this new resource in our Know Your Man Facts campaign, which is entirely focused on men's health checks. In fact, we call it 7 men's health checks to get before you die. And what this does is we don't have a lot of time to go into great detail about each of the individual checks, but the idea is to leave us all with more knowledge of the different health checks that men can get at different stages of our lives, from our teenage years right through to later in life. So it's good information for ourselves to think about, what age are you now? If you're in your 20s like me, if you're 54 like me, then there is a different set of checks that I might need to be thinking about than when I was in my 20s, and a different set of checks that I might need to be thinking about compared to an older brother who's in his 60s, for example. So yeah, think about, as you're going through the talk today, I welcome you to think about what checks are relevant to you, but also what checks might be relevant to the men and boys in your lives as well. So you've got a little bit of knowledge and information to share with those men and boys that you are most connected to and most concerned with. A few more hellos. Hey, Adam, good to see you back from the Gold Coast. Nice to see Jess joining us from Canberra. Hey, Fiona from Perth. You've been on a couple of times this week, and this time I'm in Perth too. Nice to be in the same city as you. Hi from Glen Council in Melbourne, Ali. NT Health in Darwin, Brett. Thanks for being here from Darwin. Lisa from Southern Bank. Timothy from Sydney. John Millman. I think it's the first time I've seen you this year. So welcome, everyone. Really great to have so many people online. So just a health warning to start off with. I'm not a GP, so please don't ask me personal questions about lumps and bumps. I'm not qualified to answer. This is, good old-fashioned health promotion, health education information that's available to all of us. Not something that we can only get from GPs. But obviously, the level we're sharing at is just non-clinical knowledge. And if you've got any issues or concerns right now, or if today's talk brings up any issues and concerns, please go and talk to a professional, to your GP or to appropriate helpline, or someone who is actually appropriately qualified to have the conversation with you. So I'm going to share my screen with you. And for those of you who came early, you'll be aware that I was trying to work out how to find the notes for this talk, and I couldn't do it. So I'm speaking without notes. So let's see how we go. So here we go. Know Your Man Facts. 7 men's health checks to get before you die. So we're going to be covering 4 key areas in this talk. Firstly, the key facts about health checks, some info about your health, some thoughts about how you could take action, and finishing off with some ideas about how we can help others. So first, we'll start with some of the key facts about men's health. I also need to work out, bear with me, how to see the chat box at the same time as doing all of this. Sorry, I am juggling many things at once, but I'm up and running now. Great. Okay, you can see the chat box too. Because I'm going to be asking a couple of questions in a minute, so I'll be inviting you to chuck in some suggestions and answers into the chat box. So just a question to all of you. When I say a men's health check, what comes to mind? What are some of the things that men can get checked for that you're actually already aware of? I know a lot of us instantly think about sort of say, prostate, for example. Fiona says heart function, prostate. Yeah, prostate, blood pressure, skin cancer. These are all coming in on the chat box. Skin, heart, and prostate. Good on you, Phil. Cholesterol, yes. Really need to get my cholesterol checked, particularly after a week on the road eating too many pastries. Bowel cancer, prostate, skin, liver. The poo test, as Ian says. Yeah, blood pressure and sugar. Yeah, all great answers. STD, STI checks. Yes, depression, says Jason. So yeah, some great answers there. All of those things we're going to cover today. Steve says mental health. Jess says brain cancer and dementia test. So yeah, lots of different things. It's not a one thing. There's not really a kind of like we often say during Men's Health Week, people just go, yeah, men should go and get their annual check. But there's lots of different things that we could get checked. So getting a bit of sort of like more detail, thinking about what's relevant to us, rather than just saying we should all go for a general check is really useful. VO2 max, John says, yeah, getting really into the heart capacity there. You're training for a marathon, John? John Rich says, yeah, check your mental well-being. John says life is a marathon. It certainly is, and you need as big a heart as you can to get through it. And John's got a great big heart if you know him. So we covered some of those things, didn't we? So we had mental health, we had prostate. There's a couple of other ideas here. Family history is an important one. The things that our mums and dads and our relatives, particularly our male relatives, in some cases, struggled with in terms of health, are important to know often because we might be at greater risk of, say, for example, heart disease or diabetes if we've got it in the family. A lot of you mentioned those physical health markers like blood pressure. Yeah, mental health came up. None of us mentioned lifestyle things. So yeah, an awareness of our lifestyle sort of behaviors like smoking, drinking, and eating too much or not enough of something. Who here eats too much or not enough of something? I know I'm certainly guilty of both of those at times. Okay, so yeah, it's a broad, when we talk about health checks, it's a broad range of things. Open question. I welcome your thoughts. Why do you think men's health checks are important? I mean, you obviously turned up for this talk, so you think they are, but I welcome your sort of any ideas you have on why specifically you think men's health checks are important. Okay, it's good preventative measure, says Justin. Helps us lead a long and healthy life, says Tim. You don't want any surprises, Kevin. Quite right. Better to know sooner. Yeah. Early diagnosis. Get the most out of your carcass. Yeah, okay. Nicely put. My wife needs me to keep living, says PW. So we can be proactive rather than reactive with our life. To prolong life, get early warnings. Early detection can improve outcomes. Yeah, these are all fantastic answers. I particularly like Glen Kerr's "Get the most out of your carcass." That's I can see that being printed on a T-shirt, Glen. It's a good Men's Health Week T-shirt. That get the most out of your carcass. Robert Amos says to provide a baseline. Yeah, so we know where we are right now and we can see what's changed going forward. I think sometimes that's recommended with by certain people with PSA to track PSA for prostate over your lifetime. Different views on that, by the way, but certainly that's something a lot of people advocate for. Mental health specifically can prevent domestic violence, says Sophie King. John, help us to plan on how to pay for chronic issues and funeral. Wouldn't it be nice if we had a finish by date, John, so we could actually work out exactly how long we had left? Yes. Kev James says diet, to find out what diet changes are required. Ian says quality of life. Yeah, all great answers. The number one is actually literally health checks can save lives. Health checks can flag up issues that if they weren't caught and dealt with would have led to an early death. And lots of working in this sector, we hear lots of personal stories about that. The guy sitting with the doctor or the impromptu check where they said, if we didn't get you today, you were a goner, mate. So not in all cases, but that's certainly a really, really good motivator. Quick quiz for you. Again, checking some answers. Who do you think is getting more health checks on average? Is it men or women? Is it young men versus old men? The most advantaged men in society versus the less advantaged? Blokes in rural settings versus blokes in cities, Indigenous men or non-Indigenous men. Any thoughts on that? Have a guess. Women, old men, rich men, says John. Women, old, rich, metro, none. Yeah, look, it's kind of you know, none of that would surprise you, but it's an important reminder that yeah, we simply say often, well, men don't get checks and women do. It's more complex than that. Some men do, some men don't, and there are certain factors which make it more or less likely that we'll get checks. It's interesting to compare the amount of men that get checked versus women. Now, one thing I like to sort of point out is that in terms of the health system reaching out to us as men to get checked, some of you will be too young to know this, but for those of us who've hit 50 and older, we get a lovely surprise on our 50th birthday, and that we get a letter from the government. We kind of go, oh no, I haven't been caught speeding, have I? What is this? Have I paid all my taxes? And it turns out to be an invite to take part in the bowel cancer screening. That's the first time we actually get proactively asked to come into the health system for a screening. Guy mentioning that it's just recently been dropped. Yeah, that's right. And so in terms of the national screening programs on cancer, 80% of invites that are sent out to women rather than men, because women have not just the bowel cancer, but the cervical cancer and the breast cancer screening. When we are invited to get checked, men do broadly, on average, sort of take part in screening fairly equally to women, but this tends to increase as we get older. And also, when you look at things like heart checks, which are now freely available on Medicare if you're fortunate enough to have a GP who offers that service. Blokes are getting heart checks about the same numbers as women. However, men under 65 are 4 times more likely to die of heart disease than women. So ideally, we'd like to see more men getting checked at a younger age. Yeah, a couple of people pointing out that the free bowel cancer screening is moving to 45 from the 1st of July, which is a really good move, because the younger we can actually identify issues, the better. So yeah, so men do get health checks, often get them in the same numbers as women, but actually it's thinking about when do we need those health checks most, and how can we get men in there earlier? So yeah, as I said, we actually, generally speaking, give men fewer chances to get health checks than women. But there are ways we can make it easier for men to get health checks. I don't know if any of you've seen this. You'll be familiar with the fact that we lost Shane Warne at the age of 52 a couple of years ago to heart disease. Well, the Shane Warne legacy has been doing some amazing work, taking heart health checks out to big sporting events like the Boxing Day Test. Recently, they did a session out here in, not out here, I'm in WA, out there, over there in Queensland. During the NRL Magic Round, there was a push in Adelaide during the AFL Gather Round. And we find that when we take testing out to men, be it a workplace or going out to rural settings or going to sports events, that men jump at the chance to, many men jump at the chance to get heart health checks. So we're really interested in how do we actually make these sort of simple health checks more available to men in places where men are, like workplaces, like sports events, like community events. But for ourselves, it's up to us to be proactive, because if we wait to be invited to get a check, we might be waiting for a long time. So today it's important for us to think about, well, what checks are relevant to us, and what checks are relevant to the men in our lives, the men that we care about. So we're going to look at our own health now, your health, my health, our health, and why health checks matter to us. Quick quiz. Check in your answers in the chat box. How many Australian men a day die from a preventable cause? So this is men dying under the age of 75 from a cause that could have been prevented. A couple of people guessing 100. Everyone's going for 100. Any takers? Lisa's given us 50. Higher, lower? Everyone's going for the 100. Andrew's, 50s and 100s. No one's going for 5 or 10. Oh, Fiona's gone for 10. Okay. Yeah. Thank you for everyone. There's no prize for this except for the glow of personal satisfaction of getting the answer right. The answer is 50. So that's 50 Aussie men a day under the age of 75 dying from a cause that could have been prevented. And that's things like heart disease, bowel cancer, lung cancer, liver disease. So things that can be flagged up and picked up through checks, and things that we can make adjustments about with. So yeah, 50 men a day dying from preventable causes every day in Australia. And so health checks do have a really important role in playing in helping reduce our risk of dying too young. And we know that when men do have health checks and get a bit of a warning light, that it can be a great motivator to make some changes. It can help flag up issues like, say, high blood pressure, where medication can help. So really valuable. It can really just be a great sort of way of nudging us to actually make a little change that makes a difference to our long-term health. So just a little seed I want to plant for a moment. You don't have to answer this, but let's have a think now about when are we personally going to have our next check. And as we go through the different checks that are available, maybe think about, which one would you put top of your list? Which one are you going to get done before the end of June, or by next month, or by the end of the year at least, eh? So let's have a look at ways we can actually take action then. So we kind of covered this a little bit already, but who knows? There's a little campaign called Know Your Numbers or Check Your Numbers, and there's lots of different numbers it's useful to know. But there are 4 key ones which link to lots of different health issues. And who wants to have a guess? Who knows what the 4 sort of key numbers that we should all know about ourselves are? I don't mean our PIN or our partner's phone number. Yeah, don't be sharing your PIN in the chat box. Resting heart rate, says Tim. Good answer. Who else? Blood pressure, someone says. Phil, yeah. Weight. Someone says they recently used the heart health check on the Heart Foundation website, which would have covered a lot of these numbers. John says PSA, pulse. You don't mean lentils, John. You actually mean ba-bum, beats per minute. No harm in checking how many lentils you're eating a day. That can be a part of a quite comprehensive heart check. Tim says you bench press PB. You want to share it, Tim? Lay down a challenge. See who's got the best. BSL 125. Pressing 125, Tim. Not bad. Cholesterol, weight, yeah. So good answers. Yeah, and John wants to know, Tim, is that 125 pounds or 125 kilos you're pressing? Stone, nice. Okay, I'll leave you guys to have that chat in the chat box and see who gets the bragging right for the best bench press numbers. But yeah, the 4 basic ones that we should all keep an eye on, and this is at any age, right? Any age. Body mass index, which is kind of weight indicator for those who don't know. It's a combination of your height and your weight, and we'll let you know whether you're a healthy weight, slightly overweight, obese, or underweight. Blood pressure, cholesterol numbers, and blood sugar numbers. So all of those are really good indicators, good early indicators for chronic diseases like heart disease and diabetes and other issues, and all things that we can moderate either through medication or through lifestyle changes. Just interested, actually. You don't share if you don't want to, but who's had one of these things tested in the last 6 months, say this year, 2020, 2023. Pop in the chat box. Yes, Steve says yes. A few people have, yeah. All of them, says David, yeah. So I came across an interesting statistic the other day. This is certainly something we should be doing at my age, sort of 50 plus. But I came across an interesting statistic the other day about young men and blood pressure. So this is men under 30. and 1 in 10 young men under 30 have uncontrolled high blood pressure. So, never too soon for us to be checking on these things and getting the young men in our lives, our mates, our brothers, our uncles, our dads, getting them checked too. So we're going to now try and list 7 different men's health checks you could get through your GP. We've already mentioned a couple of them, but let's have a go. See if we can tick the rest off. I think we've already mentioned maybe 3 or 4. Just want to acknowledge all the people that have shared about the things they've checked recently. Thank you. Yeah, lots of cholesterol, blood pressure, BMI checks, blood pressure checks. Some of these you can actually do online, as people have said. So 7 checks we should be getting. Yeah, mine says mental health. Andrew says skin cancer. Says Mark 2. Yeah. Keep clicking the suggestions, but we're going to go to, I think we've actually probably, yeah. Ian's determined to say poo in the message box as often as he can. Blood and poo, Ian, thank you. Yeah, lung cancer. By poo, Ian's mostly talking there about bowel cancer, I'm assuming. Blood tests cover lots of different things. Jess says lung cancer. Yeah. So let's see what we've got. So there's more than 7, right? There's more than 7, but thanks John and Kevin for those extensive lists you've just checked in there too. Jess, hormone checks, yeah. Great. There's more than 7, but these are sort of like 7 key ones that we've narrowed down. We just talked about numbers. We've added sense checks. We haven't mentioned that today. Sort of hearing and sight. Checking down under things like prostate and testicular cancer. Various cancers we've mentioned: lung cancer, skin cancer, bowel cancer. We've talked about heart, head. We've talked about mental health, and we've talked a little bit about lifestyle habits, like smoking and drinking and diet. Just a little bit. We've mentioned those. So what we're going to do now is rattle through all 7 of these. We're not going to be able to go into them in detail, but my invitation to you is to think about which one of these is the most important thing that you haven't had checked, and the most important thing that a mate or a bloke in your life probably hasn't had checked, and think about which ones you might think about getting checked after today. Message from Nigel about Blood Donor Week, by the way. Thanks, Nigel. Yeah, it's National Blood Donor Week this week. So you can also donate blood and in the process, get your weight, your blood pressure, and your oxygen saturation checked when you do it. There you go. We always need more blood, so consider giving blood. And a shout out to one of our members, the Tough Guys Book Club, who recently did a bit of a drive getting as many of their members as possible to give blood. Anyway, back to checks. So, check your numbers. We've already done that. 4 numbers: blood pressure, cholesterol, blood sugar, BMI. Really useful to know. Never too young to know. Sense check, the amount that we need to check. We've chucked teeth in there too. Not really a sense your teeth, but does help you eat, which helps you taste. So it's nearly a sense check. All things that we should be getting checked fairly regularly, especially teeth, and as we get older, particularly eyesight and hearing. Something we often forget. Not only can it help us take care of those things, but sometimes it can flag up other health issues as well. A good friend of mine back home recently was at a dentist and discovered he had, through the x-ray for the dentist, discovered he had a tumor undiagnosed that had been growing in his upper jaw for many years, and had that extracted almost immediately. So it's surprising what things like ICE tests and dental appointments can chuck up in addition to the obvious. Third one, checking down under. We've talked about prostate and testicular. Testicular is quite a rare cancer, but it is the leading cancer killer in young men. So having awareness, particularly for younger men, of what to look for is useful and important. Also, if you're a young man and sexually active, in particular young men, regular STI checks really important. 100,000 cases of chlamydia a year, and we generally recommend that young people who are sexually active are getting regularly screened for that. So that's something we should be thinking about. Prostate cancer, something to discuss with our doctors. It's certainly when we reach 50 or younger, if we've got a family history of it. As John says, check early if there's a history of family cancer. And Fiona points out that men can also get breast cancer. Indeed, they can. About 1% of breast cancer cases are men. So who wants to have a quick guess on the most common cancers in men? I suppose bowel cancer, David. Yeah. What are the 3 or 4 cancers that are most likely to kill us? Brain cancer, lung cancer, prostate cancer. So yeah, bowel and lung, all good answers. Bowel and lung are the most likely to kill us in our earlier years, and then as we get older, prostate cancer. And then also in Australia, skin cancer's a big one. Like the majority of us at some point will have some level of skin cancer. I think it's about 70% of Australians who have some kind of melanoma removed off their skin. The real important thing with skin cancer is get it early. There are many other cancers. General rule, if something changes, get it checked. But with things like bowel cancer and prostate cancer, often you can have the cancer without the symptoms. That's why having screening is useful. Have any concerns? Talk to a GP. Heart checks we've mentioned. They largely cover. They're now freely available on Medicare for, I think it's men over 45, though you can get them at different ages too. And they'll cover those 4 numbers, but also we spoke about, but also look at things like family history as well. Biggest killer of men, full stop. But also men in terms of premature death, it's the thing that's most likely to get us early. So really important to do those heart health checks. You can find the machines in a lot of pharmacies that you can do. So you don't even have to go to a GP just to get some of the basic information. Mental health checks. There are various screening tools available where you can do really quick questionnaires if you want to get a sense of how you're traveling in terms of things like stress and depression and anxiety. If you're struggling, these quick tests can really give you an indication of where you are and whether you need to seek further help. And doctors have lots of screening tools they can use if you're talking to your GP about it. And checking your habits. You know the stuff. How much you're exercising, what are you eating, how much you're drinking, are you smoking, how's your sleep going? Thinking about yesterday's talk, which is about sleep. So those are the sort of seven key checks. No pressure to do this, but anyone sort of thinking about those 7 key checks, thinking, is this something that you haven't had checked in the last 6 months that you think you'd like to get checked in the next 6 months? Could be dentist, eyes, hearing, blood pressure, a slightly irritating mole that's been bothering you a little bit and you're not quite sure. John says skin and PSA. Yeah. Someone else says PSA mark. Yeah. Kind of aware that you've got a bit more weight than you should have. Maybe you want to see if it's impacting blood pressure, I'll tell you what, for me, it's I know what my blood pressure is. I know what my BMI is, and it's a bit too high. But I don't know what my blood sugar is at the moment. And particularly as I'm eating a lot of cakes. I had cupcakes for a Men's Health Week event yesterday. I appear to be eating a lot of cakes at the moment. So I am asking myself, I wonder what my blood sugar is doing. I want to go and get that checked quite soon. And Nigel's adding in there, yeah. So we could have covered this in head checks, not just about mental health. As we get older, things like Memory, certainly. Yeah, checks around dementia and Alzheimer's. And just chucked in inflammation checks, CRP. Great, all good suggestions. So if you're not sure which ones are for you, it's also worth thinking about how they relate at different ages. So this doesn't just have to be about you. This can be about the men in your lives. We'll do a quick quiz. What are the most important checks, would you say, if you're in your 20s? Checking some answers. So if you're down under, yeah, testicular, yeah, good. Habits, absolutely, never too early to be checking habits. A lot of heavy drinking going on in our 20s often. Yeah, yeah, high level of heads, someone says, yeah, high level of mental health issues for younger men. Guys, just bringing us the bad news that doctors in the UK have said that no level of alcohol is good for you. I'm a non-drinker myself, but I leave it up to you to decide. Nigel's thrown in waist circumference, which is something we've not sort of touched upon, which is another measure in terms of weight, particularly for diabetes risk. So yeah, some great suggestions there. So at the very least, in our 20s, regular testicular checks. If we're sexually active, STI checks. Never too early to just get a baseline for blood pressure and stuff like that. So lots of great answers there. Joel chucked in a really great question. I don't know the answer, Joel, and it's a good one in terms of, is there a better measure for BMI, taking into account sort of things like muscle mass and stuff like that? I'm not aware of it. If anyone can chuck something in, it's a slightly crude measure, BMI, but I think Nigel's suggestion of waist circumference is a good one. That's a really good proxy for knowing if weight is a risk, is the actual abdominal or waist measure. And John says the skin fold test is better. So there you go, sharing some knowledge and information. How about in our, let's pick the golden generation. As wonderful men in our 50s and the prime of our life, what tests should we be getting in our 50s? 50s was when we get everything chucked at us, actually. And like I said, for a lot of us, is the first time the decade where we first start to take things seriously. Yeah, senses. Yeah, thinking about more regular eye tests and hearing tests. Lisa says PSA. Yes, 50s time to start talking about prostate to your doctors if you haven't already. Bowel screening. Yeah, it's when they'll first get invited to bowel screening. I would check in mental health stress at work, says Ivan. Absolutely. And the only other one I would check in there that no one's mentioned is heart as well. And final one, what about men in our 70s? What should we be checking in our 70s, or thinking about maybe fathers, uncles, older brothers, or if you're 80, younger brothers, who knows? What are the kind of checks that become more important when we get into our sort of 70s? Yes, skin. The older we get, the higher the risk with skin, certainly. John says, set up an annual full coverage physical from your GP from 50. Okay. Ian says, I will. Okay, yeah, very good. I can send you my bank details if you want to include me, Ian. Heart. Yeah, someone mentioned earlier things like memory tests and stuff like that. And Tao's talking about blood oxygen. Yeah. So yeah, most of these tests relevant at different stages, but just a little exercise to get you thinking about actually at different ages, and it'll be different for all of us, but at different ages, different tests become more important or more relevant, let's say. So it's a good idea for us all personally to sort of build up that knowledge base of what health checks are right for us at different stages of our lives. And I'm just going to come now to our final section, which is about sort of taking action for men's health. So I encourage all of us to be champions for men's health. I'm not a big one for going around telling other men what they should do. I don't think it tends to work. You want to exercise, mate. You want to get a check, mate. You want to stop smoking, mate. If it works, do it. But generally, just being told what to do doesn't work for anyone really, and it certainly doesn't really work for men. But leading by example and sharing what we've done, I think that's a great way to encourage others. So before any of us go off and tell anyone in our life to get checked, it's a good idea to actually lead by example and get checked for something ourselves. But when we do, don't keep it to yourself. Tell others, because us taking action and sharing about it can actually nudge and encourage others to take action too. So that's my invite to us all. Have something checked in the next 6 months. You probably would do anyway, maybe in the course of your normal routine. But if you weren't going to, think about what you could add in the next 6 months, and then think about, well, who might you also share that with as a way of actually just encouraging others to make health checks a regular part of their life. And my final question for you today, it's a quiz, and it's a personal quiz, is when will you take your next health check? If you want to share that in the chat box, you're welcome to. But I encourage you all to actually have a date in mind when your next health check will be. Guy says in the next 6 to 12 months. Good on you, Guy. Ian had one this morning. Legend. Colin says July. Robert says 8:15 tomorrow. There you go. That's very precise. Was that already scheduled, Robert, or is that just because of today's talk? Yeah, Ivan had one 2 weeks ago. Next one in November. Lisa says next 2 weeks. Robert says yes. I don't know what you're saying yes to, though, Robert. I don't know which question you're saying yes to. Yeah, loads of people saying. Phil's saying he's had his skin, his numbers, and his teeth all checked in the last little while. John says every year gets his skin check. Earlier with a check of and a check of your head soon as well.
Yes, Glen, already scheduled and well overdue.
Brilliant. Okay, good on you. Right, so let's just go through what we've covered then. We said, why are men's health checks important? Well, literally, health checks can save lives, and they can also encourage us to and nudge us to take preventative behaviour. Broadly speaking, we do give men fewer chances to get health checks, but we can make it easier for men, and we can make it easier for ourselves by being proactive. Sadly, we're losing 50 men a day still to preventable causes before they reach 75. And one of the tools that we've got to help reduce those numbers is health checks. So they're not just important for us personally, they're important for the men we care about in our lives. That's why it's important for every one of us to have in the future a date when we will have our next check, whatever that check is for us. At the very least, at any age, it's a really good idea for us to know our most basic numbers and understand what they mean and understand what we might need to do to improve those numbers. And we said there's at least 7 types of health checks. There's many more, but we've identified 7 men's health checks that you can get at different stages of your lives. And a reminder, it's important for us to find out which ones are important for us. And that will change. It will change each decade, each stage of our lives. The ones that are more important for us, or the frequency with which we are recommended to have them, will change. So it's always good to keep our knowledge up to date about what health checks are appropriate for men of our age. And best way to support and encourage the men that we care about to get more proactive about health checks is to lead by example, take action when we get checked, to actually take action that's recommended, and then to share what happened with our mates. A little message from Colin there saying regular health checks caught prostate cancer for him in his early 40s, and 16 years later, he's still cancer-free. That's fantastic to hear, Colin. Tao's got a few questions. Could it pose right, Tao? This is outside of my wheelhouse, but the good, interesting question. Could it pose a problem if one were to smoke just one single pack of 20 cigarettes annually? Probably not as much as 20 cigarettes every day, but probably more than no cigarettes. I don't know. I'm guessing. Sorry, Tao, not my wheelhouse. But if you're down to just 20 a year, you're almost there, I would say. What is the recommended frequency? This is Tao. What is the recommended frequency for undergoing blood tests to identify any type of cancer in its initial stages? Is it every 3 months, 6 months, considering that some cancers can develop rapidly within a few months? Look, something to talk to your GP about, because it's different for different people. And will depend on your own personal risk profile. So if you've got family members who have certain cancers, or if you come from a background that is a greater risk, or you've been exposed to hazards that increase your risk, if you've smoked a lot, therefore your risk of lung cancer increases. Really something to chat with your GP about. In terms of universal screening, as I said before, the first screening we get invited to as men is to bowel cancer screening at 50, or I think it's been reduced to 45, or I know, so we can actually ask for it sooner, I believe. Prostate cancer now, it really is down to a discussion with your GP to work out what the best approach is for you personally. It's a very personalized question, Tao, and something you really need to talk to a GP about. Cool. Great. Ian.
Sorry, can I just quickly raise something? We're doing stories around mesothelioma and other lung diseases, and I think us men have a terrible attitude to safety when working with dangerous stuff, and even a bag of cement or other things around safety masks, eye protection, hearing protection, things like that. And I'm as bad as anyone else, but just what I've seen the impacts of that, and I think we need to get a bit smarter with precautionary measures.
For those who don't know, is that the asbestos-related lung
Yeah,
disease?
asbestos is one, and I have a diagnosis around that area myself, but I've seen it, and it's easily preventable. And there's been action taken recently with the stone bench tops and things like that. So men just need to be a bit smarter around prevention there.
Right. Thanks for that, Ian. Couple of questions in the chat box here. Look, checking questions now. If you want to actually jump in like Ian did, just raise a hand or knock your mic on and jump in. We've got a few minutes for a bit of an open chat if you want to. So Charlotte's got a question. If we do regular annual GP checkups and share history, etc., with them, can we just rely on the GP to know what checkups need to be done when, or do we need to be extra proactive about certain checks? Anyone's welcome to jump in on that. I would say GPs are very busy, and we, from my experience, if we're not proactively asking, then GPs won't cover everything. It really depends on your individual GP, and you have the right to go to as many different practitioners as you want and get a second opinion. It's really down to the quality of your GP. So yes, take your GP's advice, and the medical advice. That's level 1 of health literacy. Do what we're told, but also be proactive and push for stuff that you think's important. Never be shy about pushing for stuff that you think's important, because at one level you know best what's right for your health. That's my unprofessional advice on that question. Welcome anyone else's thoughts. Question for Jess, which is, what if men are anti-mental health checks or reluctant to get them? Jess, go and have a look at our talk from Tuesday on how to help a mate doing it tough. I think that gives some great advice about how to have conversations with men who aren't traveling well. It may be that you need to get a mental health check, or you should go for a mental health check isn't the right approach for some men, but understanding how to engage men who are doing it tough in conversations about what's going on for them is the starting point, and we got that covered really well in our Tuesday session, how to help a mate doing it tough. John says, take control of your own needs, as the system will be reactive rather than proactive. I think emphasizing the point I was making there, you have the right to ask for both feedback and direct treatment. Thanks, John. Appreciate that feedback. Do you have a resource like a checklist that can be used to take to the doctor with relevant checks by age range? I think something like that is covered in Spanner in the Works, which someone else mentioned. If anyone's able to just post in a link to Spanner in the Works, that would be great. I'm going to stop sharing my screen. Hang on a second.